Well, good afternoon, everybody. It is straight up 12 noon, and that means we are going to start the I-29 MU dairy webinar. Today's topic is metritis in dairy cows. Dr. Barragan will cover the latest discoveries on uterine infection diagnosis and preventative and treatments. He is involved with Penn State extension and outreach activities, field investigations, as well as developing and performing applied research that helps dairy producers. We are very pleased to have Dr. Barragan here today to do this presentation. And as I always say, Doc, the podium is yours.
All right. Thank you so much, Fred. And thanks for I-29 MU University for the invitation. I'm very happy to be here today. A little bit of the title that I picked for the presentation is a little bit about this controversy that is out there. It has been for many, many years about the definition of metritis, right? And I'm going to try to shed some light on this today, based on the many research that has been doing in this topic and the different definitions that have been utilized, and try to come out then with a conclusion on what will be the one that we that is more applicable, right? Or the one that we can use in the field and it more fits our logistics in the farm, right? But that is sort of how I put it. I named this talk calling things by their name. And then we're going to be talking about a little bit about some of the main effects on metritis, on fertility, milk production, and overall welfare and health of the cow. And one of the latest treatment studies that have been done, actually two of those were published this year, and a couple of them sort of on the preventative side for metritis. So that being said, that is sort of like the outline, quick overview of uterine diseases. Then we're going to dive into metritis definition, all these different definitions that have been proposed out there, and what is the one that I consider is the more applicable one for our farms. And then we're going to cover about the effects of metritis on welfare and performance, and then latest treatment and preventative strategies. All right, so to kick off the presentation, some of the things they're very known by everybody. You know, the metritis, depending on which farm, or uterine disease, right? Because we can include within uterine diseases retained placenta metritis, endometritis, pyometra, right? Depending on which farm you go, this disease is going to be top three, either number 2, number 3, right? You're going to have mastitis, lameness, and metritis, right there. So it's definitely, they are definitely some of the most prevalent diseases in dairy cattle. The cost is significant, and that's some of the cost from previous studies are between $100 to $360 per case. And that considers the veterinary bill, the loss in performance, the loss in fertility, and so on. The negative effects, as you might know, are on milk, fertility, increase the risk of those animals being removed from the herd, and it affects animal welfare, right? There is a lot of data, especially from our lab. We have a couple of papers out there that we have found that actually affect behavior, affect nociceptive pain, biomarkers, and so on. So we know it definitely is affecting the welfare, and we have to do something about that. And one thing that perhaps I just want to dive right in, because it's such a hot topic to say, is the inflammation, the link with metritis. And you know, everybody here knows that metritis is an inflammatory disease, right? So it's basically a colonization of bacteria of the reproductive tract, and that causes inflammation and you know, infection and inflammation. But the inflammation is related, is actually happening before, and it's actually a predisposing factor for metritis. Of course, it's going to be more inflammation associated to the actual infection, that is the actual disease, the metritis. But cows that later on develop metritis will have higher inflammation before that. Okay, and this is a study from Hasse et al. I'm sorry, the citation is wrong there. This is Hasse et al. 2009. And what they did here, they basically they look retrospectively the inflammation biomarker, which they pick up globin, related to calving and to the actual diagnosis of metritis. But they basically have three main groups. One that were healthy animals, that they are the black ones. And then you have animals that have mild metritis or severe metritis. That will be the gray squares or the dark gray triangles. Right? And you can see that even at calving, so before calving, they actually were about the same. So but if you look here at calving at 0 days, they already were different. So basically at calving, these cows that later on develop metritis, they already have a high inflammation or high concentration of aptoglobin compared to the animals that did not develop metritis, right? And I just put in here sort of the definition because it's so different between all the studies. So in this study, they consider severe the cows that have the score of 4, which is red, brown color, watery, and fetid or foul smelling, with a fever, right? And mild metritis was cows that had no fever. So they have a vaginal discharge score of 4, but no fever, okay? So now, this sort of links well with the sort of theory of Dr. LeBlanc's, where he proposed that the cows need a strong, robust initial inflammation in order to remain healthy right after calving, right? But if that inflammatory response is too low and long, or is too high and long, it's end up into inadequate response and development of these uterine diseases. It could be metritis or endometritis, right? And those sort of that concept, like if you look at the previous graph, we want this is robust, adequate, I don't want to say small or high, but adequate inflammatory response. But if it's too high, it's going to end up in metritis. Or if it's too extended, it's going to end up in metritis. Well, sort of that concept of exacerbated unnecessary inflammation, right? Because inflammation is good, it's needed. We need inflammation this time of the cycle of the cow for expulsion of the placenta, uterine evolution. The physiological process of parturition requires inflammation. So we want inflammation here, but we need the right amount of inflammation, right? So anyhow, so I'm bringing this up here because when we talk about preventative strategies, we're going to dive a little bit into what could be the reasons of the positive effect of prevention on some anti-inflammatory strategies that I'm going to talk about at the end of the presentation. But let's go back to the actual definition. When we think about uterine diseases, I told you there are a number of those. We have retained of fetal membranes, metritis, endometritis, pyometra. You have the time line right here. So if everything that is before 21 days is either retained placenta in the first 24 hours after calving, or metritis if it's infection of that uterus, 3 layers of the uterus before 21 days, or before 21 days after calving, 20 days in milk. And then we have endometritis and pyometra, sort of the incidence there and sort of some of the main classifications of those, right? But this is sort of the basic or the more established definition they have been out there, since 2006, I would say. But let's go to the actual metritis, okay? And I just gonna go briefly to what has been established and what might have to change, perhaps. But the established definition of metritis, we have clinical metritis and we have puerperal metritis, right? The clinical metritis is basically abnormal vaginal discharge. And I only put that because we're gonna go through some literature to try to come out what that means. What is abnormal discharge? Is pus, is no pus, is red brownish, is watery, is no watery, right? So we're gonna go through what is abnormal for metritis. And the main difference between clinical and puerperal is just a systemic, so it's the systemic form of metritis. So metritis could be a localized infection of the uterus, or those endotoxin or those metabolites produced by bacterial inflammation can escape the uterus and go into the blood and cause more systemic signs such as fever, anorexia, which is basically drop in intake, drop in milk, yield and so on, right? So that's sort of the purported version of metritis. But the main thing, the more debatable thing here is the abnormal vaginal discharge, okay? All right, so I'm gonna dive into and sort of dissect a really nice article published in 2022. This is from some colleague from California, mainly Dr. Da Silva, Dr. Lima, where they did a meta-analysis. So the meta-analysis means that they they basically look for any research study has been that is out there published and have defined metritis, and then they aggregate that data and they come out to what was the most common parameters that were utilized to define metritis. Okay, so here we have days in milk, diagnostic tool utilized, and the frequency that the disease was assessed, right? Just to make it easier for you, the most common timeline that metritis has been assessed in peer-reviewed research is in the first 21 days in milk, okay? Now, when it comes to the diagnostic tool, the most common ones are through either a uterine massage or a glove hand that's basically inside the vulva into the vaginal cavity and just grab that discharge, or the Metri check, okay? And these actually are some of the most common practices done in the farm, right? So if you look at the different diagnostic tools utilized in farm, they're actually some of the most popular as well. And when it comes to sampling frequency, this was daily or one time during the study, right? And that's usually between the seven plus minus 3 days in milk is a really common time to sample the cows. I gotta mention that this has studies from like 15 years ago, and you might agree with me that now the monitoring of fresh cows has shifted quite a bit, right? We're not doing anymore that daily checkups with vaginal discharge, temperature, intake, and so on. We're a little bit more hands-off these days, right? We're relying more in activity monitors or some technology is gonna allow us to, it's gonna flag the cows based on milk production, rumination, or activity, right? And that appears to be the trend where industry is heading to, right? There might be some benefits about animal handling stress being decreased, unnecessary handling stress of those animals, and unnecessary actual interventions, right? But that's perhaps the data from this meta-analysis, which might be a little bit off from the actual reality in the farm space. Now, when it comes to the features of the vaginal discharge, they look at odor, color, and viscosity. And one by far that was the main, when it comes to odor, the main feature was either fetid or foul, which to me is the same. It's basically that putrid smell. When it comes to color, most of them, pretty much everybody agree that it's a red brownish color. And when it comes to viscosity, most of the one was watery, okay? So let's see now about what they base the treatment decision on, which this is a really nice part of the study, because they say, okay, what was our parameter to say we treat these cows or we do not treat it, right? And for that, they actually have systemic signs mostly, right? There's some studies that actually did only abnormal vaginal discharge only, but most of the study, they have the combination of systemic signs and vaginal discharge. And we'll talk about that a little bit later, especially about a study that we published a few months ago this year, where we actually found difference between the treatment approach that we utilize based on the discharge of the animals. And then for definition of cure, most of them, they basically, if the vaginal discharge is normal or is abnormal, right? And here's basically, it's the same thing about what they consider abnormal discharge, and that was the watery and fetid discharge. All right, so now, when it comes to the definition and the vaginal discharge, we talked about let's go back. So let's recap right here. So we talk about fetid, red brownish, and watery. Okay. All right. So we did a study that we published this year, where we basically have two scores that we thought that they were pathological, they were abnormal. Vaginal discharge score 4 was red brownish, was watery. So we have 2 out of the 3 that I told you, but did not smell putrid, like without a fetid smell. Okay. And then we had the vaginal discharge score 5, which was red brownish watery, and it was fetid. So that's the one that aligned to this latest study that I showed you. Okay. So now what we found when we compare these two scores when on lines of milk production, rumination, and metabolites is pretty interesting. So what you have in the graph in the top left corner is daily milk yield from 4 days in milk to 11 days in milk. And we did the diagnosis at 7 days in milk. But basically these animals were had metritis or vaginal discharge score 4, vaginal discharge score 5, the ones that are the basically the brown diamond, the red square were the score 4, and the normal ones would be the light gray triangles. Okay, so what you can see there that it didn't matter if they had vaginal discharge score 4 or 5. For daily milk yield, it was decreased in both groups, right? It was decreased for vaginal discharge 4 and 5, and you can see that sometimes even more decrease in vaginal discharge score 5, but vaginal discharge score 4 was different from those normal animals. Similar thing when it comes to rumination, we have decreased rumination in vaginal discharge score 5 animals, a little less decrease, but still different from normal for vaginal discharge score 4. And you can see this is fairly maintained all the way until day 8 days in milk and so on. Okay. Now, when it comes to metabolites that we assess aptoglobin for inflammation, beta hydroxybutyrate for metabolic stress, and we look at body condition score. And you can see here, this is the inflammation for normal cows, so fairly low. This is the inflammation for score 4, and this one, the brown, is the inflammation for score 5. So you can see that score 5 definitely has high inflammation than score 4, but score 4 has higher inflammation than normal cows. Okay, so if you ask me, these score 4 cows are normal, and say no, those cows are diseased. Okay, those animals are sick, and their performance and their physiology is showing us that. Right? With beta hydroxybutyrate, we actually only found difference between score 5 and normal. But with body condition score, we actually found that both score 4 and score 5 both have a lower body condition score compared to the cows that have a normal vaginal discharge. Okay. And that I want you to hold this thought about vaginal discharge for red brownish watery without fetid smell, and the 5 being red brownish watery with fetid smell. Okay. All right. So now, what about different activities? So when we think about the definition, what about the activity monitors and how they basically come up or diagnose or they flag these animals? This is a really nice study from Dr. Giordano lab. Matthias Stangefer was the first author here. And in this study, they have rumination and activity from the CR system. These colors, right? Activity monitors, they measure rumination, activity, and they have the capability to flag animals based on variations on these parameters. But what you have here is 0 is the day that they diagnose, they clinical diagnose the disease, and then they look at 5 days before and 5 days after, right? And there are 3 main groups. The black circle are the healthy animals. The gray circle are the animals that they have a clinical diagnosis, but the system didn't flag it, right? So the HIS was higher than 86, which means that the changes were not significant, were not considered pathological. And then the HI plus is the animals that were clinical diagnosed with metritis and the system flagged them, okay? And you can see that basically those are the group that actually have different rumination and different activity. So lower rumination and lower activity on the animals that have a clinical diagnostic by a personnel, and they had the flag, the actual system was flagging based on the variations on these parameters. So definitely it could also be used as a diagnostic method when there are changes in rumination, there are changes in activities, and many of these, this is only one example, but there's a number of these devices out there that have the capability to assess rumination activity, some of them even temperature, right? And those can be used in conjunction, so together, right, with actual physical examination of that. And if we do that, if we do the physical examination and found this abnormal vaginal discharge, that's the animal that we need to do something about, okay? They also found different in milk as well, and this is like the days before calving, I'm sorry, before diagnostic. But this was interesting, was mainly in multiparous cows. So BR multiparous cows and AR primiparous cows. Although primiparous cows, there were a few days, but most significant effect on primiparous cows. And again, on those groups that they were flagged by the system, okay? So if we have to conclude on what is the actual definition, that the one that we can definitely apply on our the farms, I will say an abnormal vaginal discharge, which is red, brownish, watery, with or without fetid smell, and with or without present on systemic signs, right? Drop in milk, drop in rumination, fever, right? But it kind of cannot have that. Again, it could be it could be local, or it could be already more severe. But these are our metritis animals. This is what we should define as metritis. All right, so what are the effects of metritis in physiology? I mean, there are effects on many areas that you can think of: behavior, pain, inflammation, stress, performance, right? Here's some data from a study we published in 2018, where we compare healthy cows in blue compared to metritis cows in red. This was a cross-sectional study, so one snapshot of diseased cows or healthy cows, and you can see higher inflammation and higher, this is substance P, which is a nociceptor of pain. So it's pain and inflammation. Both markers were elevated in animals that have metritis compared to normal vaginal discharge animals. So now there's another study that was published like a couple of years before the one that we published, and they found that they have higher visceral pain as well. So they did a palpation and they measured how much the animals arch their back if they have metritis compared to the cows that did not have metritis. And you can see in this graph that actually, and this was all actually measured very detailed measurement of all of these, but basically the conclusion was that they have a higher arch of their back if they have metritis when the practitioner did rectal palpation. Activity patterns were also affected, and here is laying time on cows with metritis or healthy cows for 1 week after diagnosis. And interestingly, we found an association by parity. Primiparous cows appeared to be more affected by this compared to multiparous cows. So there was no different multiparous cows, and primiparous cows, they had an increase time that they spend laying in their stalls. And we conclude in this study that could be associated to the sickness behavior, right? When we don't feel good, when we have a fever, we don't want to go around and walk and socialize. We just want to lay down, right? So that was sort of the conclusion we have. In this study, however, we did not find significant difference in milk yield when we look at the DHI test. So we look at DHI test 1, 2, and 3, and you can see there was no difference here, about 32 kilos versus 33, and so there was no difference in any of these. However, when we look at the daily milk yield, and there's some data from a few studies that I aggregated here, where you can see the cows without metritis and the cows with metritis, there is a clear difference, but especially while the disease is ongoing. After that, doesn't appear to be that meaningful. It's usually around the disease and sort of the healing time for the disease. But then I went on and sort of split this data into cows that have normal metritis or have severe metritis, which was the abnormal vaginal discharge and fever. And surprisingly to me, fever didn't change much the negative effect on milk, okay? So it didn't really matter in this cohort if the cows had fever or not, the milk drop was about the same, okay? All right, and now on the study that I mentioned earlier about from Dr. Giordano, the Stanga First study, they look at that meal differences, and I sort of already told you about that. And one comment that I want to make here that is interesting, that they found a more profound effect on multipurse cows, on meal yield, which to me was interesting because in our study for activity patterns, we found that primiparous cows have a better, a more profound effect, negative effect on those activity patterns. But with meal yield, it actually was the other way around. The multipurse cows have a higher drop in meal yield. So that was very interesting to see that discrepancy there. It's another study that also looked into meal yield, and they found similar associations when it comes to the parity. They found more profound effect on multipurse cows, which is interesting that there are these similarities between labs. But in this study, they have a different categorization, okay? They have healthy cows that are the cows, or metritis cows, that they are the white squares. And then they have cows that have metritis, and they were treated and they were cured, right? Which are the black circles. And then they have cows that have metritis but did not respond to the treatment, so they did not cure. And those are the triangles, right? Those gray triangles. And what you can see here, so it's very obvious that both of them, so at the beginning, these are at the month postpartum meal yield, and if you look at the graph in the bottom right corner for multipurse cows, the beginning, the first 3 months, you can see that both groups, the one that healed and the ones that didn't heal, didn't cure, were low. But after month 4, those metritis animals that responded to treated, they actually level up with the normal animals, right? But the animals that did not respond well to treatment, they actually never level up to that, and the milk production will remain low for pretty much what they have about 10 months of lactation here. Okay, so interesting about like what treatment response also have a more profound effect on milk production when it comes to this disease. With reproductive performance, there's a number of studies, and I don't want to spend much time here, but I have a few summaries. So for days to first estrus, about 5 days longer. Days to first service, about 7 days longer. About 0.33 more services, 20% less conception rate at first service. About almost 19 days more open, and a lower risk of conception or getting pregnant. So this is a meta-analysis that was performed, it's all but still fairly relevant, about the big effect that metritis have in reproductive performance. Going back to the study that I showed you earlier from 2021, with a group of no metritis or metritis that got cured or did not get cured, you can see here, this is basically a survival curve. All the cows are open at the beginning. As we start breeding the cows, they're going to be removed from this pool. So the lower the body gets, the more cows get pregnant. So you can see the normal cows, actually a high percentage of those became pregnant. But then you can see that the ones that respond to treatment were better than the ones that did not respond to treatment. And there was a clear difference between the ones that did not respond to treatment and the ones that were healthy. When it comes to cooling rate, this is sort of the opposite. The higher the bar, the better, right? Because the lower the bar goes, the more animals are removed from the herd. And you can see that here now we have those Metritis cows did not respond to treatment. They are at the lowest score, and it's basically about 30% of them were removed versus 20, versus 19 or so. Because basically the cows that did not have Metritis, or the cows that had Metritis or respond to treatment, they actually were not. They were about the same cooling rate. All right, so this is sort of a brief snapshot about the very significant negative effects of Metritis on performance and welfare of the animal. So, how can we diagnose this disease? Number of ways. Yeah, we can do vaginal discharge score. We can do endometrial inflammatory cells assessment. We can do uterine fluid and wall thickness, uterine wall thickness assessment. For vaginal discharge, we have visual observation, glove hand, metric check, vaginoscopy. For endometrial inflammatory cells assessment, we can use cytovash, cytotape, uterine lavage, biopsy. For uterine fluid and wall thickness, we can do ultrasonography and palpation, basically for the fluid. But that's not some of the most common method, and I'm just gonna go through a few of them, perhaps the more meaningful ones and the ones that are more applicable. And one of the least expensive ones and the more practical diagnostic method is visual observation, right? So basically, we go to the pen, to this fresh cow pen, about an hour and a half, 2 hours after feeding. Most of our cows should be laying. If not, we definitely have to take a look at that, but most of our cows should be laying. And basically what happens when the cows lay down, all the pressure of those gastrointestinal organs are gonna press on the uterus, and if there's fluid there, it's gonna help expel that fluid. And this one we're gonna be looking at these discharges, and especially early on in the first couple of weeks after calving, as the cow progresses on lactation, that cervix is gonna get smaller, it's gonna start closing, so it's gonna be less likely that fluid is gonna come out. But it's a fairly easy, low handling stress diagnostic test. But you might end up with some false negatives, right? You're not going to find all the cows that might have this condition. But definitely might find the more severe ones. The glove hand technique is basically you are going through the vaginal cavity and you're going to scoop out that abnormal fluid. It's more accurate, can be traumatic. You have to restrain the animal, so you are in that handling stress as well. You also have a risk of introducing abnormal bacteria as well if you don't have hygienic practices. So, this is not one of my favorite. Usually, I do not recommend doing this, but it's definitely a diagnostic out there. And then perhaps one of the one that had been fairly popular lately in research studies, the metric check technique. And it's a device. It's a stained steel rod with a rubber cup in one end and a handle in the other one. And it's basically, I have a short video right here. You just clean the area with a paper towel, and you introduce that device sort of in a 45-degree angle to avoid getting stuck in the urethra exit. And then you just go until you reach the cervix, or sort of like you feel some resistance, and then you just do a few scoops and remove the fluid and assess that abnormal fluid. Oh, that fluid could be abnormal, it could be normal, but that is sort of the main. And very simple, very low traumatic, but again, you had to restrain those animals, right? So how we use this also is important to keep in mind when we use that. Endometrial inflammatory cells. This is a technique or diagnostic tool that I do not recommend using unless we have a problem, right? Unless we know that we have some issues with uterine diseases, or we know that we have some issues with uterine involution, our cows are not clearing or clean up on time, and then it's something that we can take a look at. It's mostly for endometritis. We don't want to do this for metritis. That uterus too big. It's not, it's really hard to make contact with the uterine walls, but there's definitely a technique that can be used to troubleshoot. And that's how I recommend using this, to troubleshoot uterine diseases issues, especially when they are related to fertility, with that first service conception rate, right? Or with that first service issues, because quite often they can be related to subclinical inflammation of that reproductive tract. Uterine lavage is sort of the same, is similar to the cyto rash, and it definitely can be used, but as I mentioned before, sort of in a troubleshooting matter for that. And basically what it is, we just collect cells from the endometrial wall, and we will look at those cells, and we're looking for all of these multilobulated clear cytoplasm neutrophils right there. All of those are neutrophils. So these actually they have a lot of those in this smear. Uterine ultrasounding as well. There are so many papers out here that they look at different cutoff. They look at sort of abnormal. Here I should say abnormal is more than 5, because if you can measure 1 or 3 millimeters consistently and accurately, you gotta show me how, because I just can't. But for the practical aspect, that was what I recommend. And the same sort of when it comes to the thickness of the uterine wall, we're talking now about 8 millimeters, and the diameter cervix 7.5. And again, this is also more popular for metritis. All right. And one thing that I wanted to mention about just going back to this the activity monitor study is that we could use that, and actually that if I have to come out with a final take-home message about diagnostics, my recommendation, if we have this technology in the farm, is that we can use it together, right? So we can use this the technology for when an animal is flagged, we can use either a rectal palpation, rectal massage of the uterus, or a Metri check to assess the vaginal discharge of that animal and see if it matches the definition that we talked about before, right? That red, brownish, watery, with or without fetid smell, right? And then we can decide what treatment strategy we're going to use for that. So when it comes to the treatment approach, we have done some research on if we can use the vaginal discharge score to pick which treatment might work better, okay? And there's still more research to be done in this area, but we did a couple comparison of these. But just to give you an idea of what was our definition, because as you know, it varies a lot based on the studies. We use a score 1 of just clear vaginal discharge, totally normal. A score 2, they have some flake of pus, and it's less than 50%, just a few flakes. A score 3, yeah, when you have more than 50% of pus, but it's just pus, there's nothing red, there's nothing brownish, it's really dense, right? It's not watery. And the score 4 and 5 was those 4 would be the red, brownish, watery without fetid smell, and 5 was our red, brownish, watery with fetid smell, or that foul smell. And what you can see in this graph is that basically score 4 and 5 did not differ. They were similar when it comes to the concentration of aptoglobin in the vaginal discharge. So how much inflammatory markers were in that discharge were similar, but the 4 did not differentiate from 2 and 3, and the 5 different from 2 and 3. So that's sort of that same message that the other study gave us about the 4 is not as severe as the 5, but it appeared to be different from the 1, 2, and 3, the normal ones, right? Although in this study is a little less straight cut like the other one, but it's definitely sort of the same message that is given in this data set. So now I'll show you this study already. And based on this, I just gonna dive into the other part of this study where we actually treat these cows with two different treatment strategies. Okay, so I'm gonna leave this out, just bring it back as a refresher, right? That we found that the 4 and the 5 were different from the normal, and the 4 was a little less negative, if we want to say a little less negative effect on the parameters that we look. So treatments that have been proposed to metritis likely is a disease that responds well to treatment, right? Antibiotics, usually 3 or 5 days of treatment, the animals respond well, and there is a good cure rate, about 80%, 85%. Depending on the severity of the disease, if we have systemic signs, we have to do other palliative therapies, such as fluid therapy if the animals are dehydrated, antipyretic or anti-inflammatory drugs if the animal have a fever, right? And this is actually one study that show a benefit from prostaglandin F2 alpha for the milder condition, right? The endometritis or the pyometra. And local treatment perhaps is another area that has been a lot of research, especially in organic farms, right? Not being able to use antibiotics is definitely a challenge when managing this disease. And when that is the situation, we need to come out with a strategy. And the key here is going to be prevention, right? How can we prevent this disease? But these also studies have shown positive effect about local treatment. Now, I'll cover only a few ones just because of time, which is it's a very broad topic. But one new study that perhaps you don't have it here because I sort of showing you in combination, right? But this study that was published this year from Dr. LeBlanc's lab, where they compare only treatment with an anti-inflammatory drug to an antibiotic treatment, right? So sort of that concept, would an anti-inflammatory alone be enough to cure the cows with metritis? And they come out with pretty interesting results. Here's sort of the experimental design outlined from the study that they did the diagnostic, and they did treatment for 3 days, either with the anti-inflammatory that they picked the ketoprofen, which is a non-steroidal anti-inflammatory drug, or Septiofur, right, cephalosporin antibiotic. And they did it for 3 days. And then they measure a number of things, aptoglobin, they measure cure rate, they measure milk production, and cooling rate, and others. And basically what they found, what you have here is milk proportion of so basically fertility and cooling rate. And what they found is, just as a overall message, is that there was no difference between ketoprofen treatment alone or antibiotic treatment alone, right? When it comes to the milk yield, you can say you can see healthy animals here are red, and then Septiofur are the black, and ketoprofen are the gray. And you can see, there were a few weeks that they were different, but then they sort of level up in the same way. The same with fertility. There was actually no difference in fertility between neither of the groups. And in cooling rate, there was sort of the same. There was no difference between Septiofur and ketoprofen, suggesting that the efficiency of treating this condition might be similar, which is very promising, because when we think about the issues of overuse of antibiotics and antibiotic resistance, and the whole sort of dilemma that we have in this area, anti-inflammatory treatment alone as an alternative strategy for metritis, if proven to be effective, would be a really valuable tool to have, right? Now we have to see what anti-inflammatory drug can we use, right? And then the other study that I wanted to cover when it comes to treatment that we published, this also was published this year. This is from our lab, where we compare we compare intrauterine dextrose alone with systemic treatment, antibiotic systemic treatment alone, right? And here you have sort of the experimental design right here, and you can see that we have the conventional treatment was antibiotic, the cows without metritis, and we have cows that were treated with intrauterine dextrose. That was our local intrauterine treatment. And we basically did 3 treatments with dextrose, 1 liter daily. So the diagnostic day for treatment, the day after, and the second day after, so 3 days treatment. And the Septifor was actually 2 treatments separated by 72 hours. And then we'll look at, oh, here's the same, sorry about that. And then we'll look at different parameters. But the interesting part here is that we found different results on performance parameters based on what groups of metritis cows we included, okay? And what you have here in the top right corner, you have the clinical cure that was similar between these groups. So either if we treat the animals only with dextrose or only with conventional with the antibiotics, they have similar cure rates, so there was no difference. And then when we look at milk yield of the cows that were vaginal discharge score 4 only, right? No, so they were red, brownish, watery, and the discharge did not smell bad. So there was no fetid smell or foul smell. You can see that here's 150 days of milk yield, and this is daily milk. So you can see at the beginning, you know, around 7 days when we diagnosed those cows, that milk drop, right, when the cows were sick. But then about 20 or so, 25 days after calving, or basically 15 days after disease diagnosis, those animals, the milk production leveled up to the normal animals with both treatments, dextrose or intrauterine dextrose or the systemic antibiotic treatment, okay? So for vaginal discharge score 4, either of these treatment options was effective at curing the animals and effective at improving or basically, improving the milk yield, okay? So now let's take a look at the animals that, when we only include animals that have vaginal discharge score 5, okay? And now the thing changed a little bit, right? So now we have that dextrose just wasn't enough for these animals. So basically what you're seeing here is that, you know, at the beginning, the milk yield was low, right? When the animals were sick, and even before, if you look at this graph, before the animals were sick, there was no, but when they are sick, they actually drop. But score 5, as we know, is a more severe condition. So even before they actually were diagnosed, that was about 7 days in milk, it was already low. But then the animals that were treated with systemic antibiotics, they leveled up to the level of normal animals around 20, similar to the other group, yeah, 20, 25. But those dextrose cows, they never caught up, okay? So the conclusion that we got from this study is that intrauterine dextrose might be beneficial for those milder vaginal discharge score 4 groups, but definitely not recommended for the vaginal discharge score 5, okay? All right, what about prevention? And we're gonna wrap up with this couple slides about prevention. And I know it's a lot of debate about this medication debate these days, so we're not gonna get into that area. Happy to answer questions about this at the end, or if you wanna send me an email or give me a call, more than happy to talk about this, but I'm just gonna focus on the research that we have done and the effect on preventing metritis, right? And these are 2 studies that we published in 2020, where we treat aspirin either with 2 oral boluses of aspirin every 12 hours for 2 days, or like a more applicable strategy, which actually the results were almost exactly the same, where we did 4 oral boluses of aspirin in the first 12 hours after calving, And we did that every 24 hours. So basically right after calving, or within 12 hours after calving, and then 24 hours later, and that was it, right? So 2 treatments with 4 boluses. And the effects that we have on prevention of metritis was very interesting. We actually found a decrease on metritis incidence at 7 plus minus 3 days in milk. And also we found a decrease on clinical endometritis on the animals that were treated with aspirin, right? And our hypothesis here is sort of that we are treating that inflammation that I showed you from Hasse et al. 2009 study, where we saw that aptoglobin was higher right at calving, and later on that it's believed that it's a predisposing factor for those animals to develop metritis, right? But if we treat those animals with a milder anti-inflammatory medication right at calving, we might help bring that inflammation back to normal and prevent that inefficient or exacerbated inflammatory response that might predispose the animals to develop metritis. We also did a prepartum anti-inflammatory study. I'm sorry, here is the title is off. It's prepartum, and in this study we published this actually 3 months ago. But in this study we treated the animals with aspirin or meloxicam or a placebo, and we treated the animals 14 days before calving or before the expected calving date, right? And it was really simple treatment. It was 1 dose of aspirin, that were those 4 boluses, or 1 dose of meloxicam, which was, we use 1 milligram per kilo. It's about 32 pills of the small animal prescribed medication. And what you have here is that on average, the animals that we treated, they had the actual calving date 10 plus minus 5 days from the time that we treat those animals, right? So the animals calve 5 to 15 days after we treat those animals, okay? Because as you know, expected calving date is a little, it's not super accurate, right? There's a big variation there. All right, so what did we found on clinical health events overall? This is animals treated with aspirin, meloxicam, or placebo. Here in the left, we have all the animals, and these are percentage of animals that develop at least 1 disease in the first 60 days in milk. And what you have here overall, there was no different. And actually, they are very similar to the national rates of health events, right? About 30 to 40%, 35 to 40% of the animals will develop at least 1 disease. But then when we divide those animals by body condition score, we found that the overconditioned cows that they were treated with aspirin, they have half less incidence of diseases compared to the animals that were treated with meloxicam or placebo. So aspirin appeared to have a positive effect on preventing diseases overall, right? Not only metritis. But what about when we look at metritis specifically? And here you have stillbirth and metritis. And you can see for metritis, we actually found an interaction by parity, where primiparous cows treated with either aspirin or meloxicam, they have lower incidence of stillbirth. And the animals, primiparous cows treated with aspirin, they have a lower incidence of metritis compared to meloxicam or placebo, okay? So sort of that anti-inflammatory, prepartum anti-inflammatory treatment appears to have positive effect, but not in all the animals, but in specific categories. And those were overconditioned animals and primiparous animals, okay? All right, so to summarize the talk, I think that we know that uterine diseases are prevalent and have important economic losses for the farm, affect the milk yield, affect the fertility, affect the welfare. We know that different diagnostic, different definitions have been established. It's a matter just to find that one that is more applicable to our farm, right? And when it comes to treatments, there are definitely treatments available there, but I think these days we really have to focus more on prevention and what type of strategy we're going to be using to avoid having to treat these animals and and go through all those negative effects that we talked about. So with that being said, thank you so much, and I will happy to take any questions.
Thank you very much, Dr. Barragan. We appreciate that information. We're kind of a small group here. If you would like just to unmute and ask a question, or you can type them into the chat box. I see Gail has come online. I'll bet you've got a question.
I have kind of a broad question. So we see a lot of movement more towards more hands-off fresh cow management. You made a really great case that we need to be managing mastitis, or sorry, metritis, and showed a lot of really interesting data. And I think the natural inclination is, oh, I'm going to lock up my cows more so that I can, do my fresh cow checks. And so you talked about this a little bit, but what are some of the best practices that you can say for finding that balance with we want to manage metritis, but we don't want to over handle our fresh cows?
Yeah. Hey, Gil, how are you?
I'm great. I
Yeah,
just listened to a fantastic webinar, so I can't be better. Yeah.
Thank you. But yeah, I mean that's exactly where the biggest debate these days is what to do, what we do now. What is too much, what is too few, how we cannot miss cows. One thing that I didn't even have time to cover it was the self-cure rate of these animals. About 40% of them will get cured by themselves. We don't need to do anything. So how we identify those animals, right? But I think that the short answer to that question is that we have to have a combination. And I don't want to go on and tell everybody that they need to start getting activity monitors because these are big upfront cost. But if you have it, the best way to utilize that technology is by combining that to the clinical examination of those animals and the vaginal score assessment, right? So if you have an animal get flagged for, it's not going to tell you it's going to be flagged for, it has metritis. No, it's just going to be flagged, right? It's going to tell you it's off. It's not going to tell you specific what disease it is, right? But in a fresh cow that is flagged for low rumination and low milk production, one of the first things you got to look at, especially if it's coming back from the parlor and doesn't have metritis, because otherwise it would have been diagnosed in the parlor, is the vaginal discharge of that animal. And if we had that vaginal discharge in the score 4 or 5, that animal, we need to do something about it, right? And that's another thing that it depends on the farm, on the protocol, how aggressive you want to do on that, and follow your veterinary indications as well. What treatment approach you want to use, right? We did this study where we actually found that one could be better for another, but one thing that we really want to do that is a little bit controversial because I could and so on is like, what about if we leave those animals alone, the vaginal score 4 alone and the vaginal score 5 alone, compared to what we do at treatment? What is the actual difference there? Can we leave those vaginal score 4s alone, and will they be okay, right? Or could those be the ones that we don't need treatment? Our studies with dextrose and with antibiotics shows that either that the treatment is benefiting milk production. But yeah, I think that I just branch out a little bit. But when it comes to how diagnose those, if we don't have those technology, if we don't have the activity monitors, what we can do, we can have a weekly checks on those animals. Instead of every day checking those animals, we can do once a week on the animals, the high risk animals, and those will be 7 plus minus 3 and 14 plus minus 3. So those 2 first weeks are the most risky for metritis, and that's approach that we can go is to try to dive away a little bit from that daily checks up that I believe we don't need that anymore. We are adding unnecessary handling stress. We're adding unnecessary management of those animals. The cows do well, right? We just need to let them be cows.
Yep. Now is probably a good time to pitch. If you're a dairy producer in Iowa, or if you work with dairy producers in Iowa, there is currently a grant available from Choose Iowa for labor reducing technology. I know a lot of the producers who submitted for this grant last year were interested in getting activity monitors. So if you are currently in Iowa or have clients in Iowa, that might be something worth checking out.
We have a question from Carissa. Do you have any idea why the prepartum anti-inflammatory therapy was only found to be helpful in the overconditioned cows?
Yeah, Carissa, how are you? Yeah, that's a great question. And we believe is that basically what we found in data, these overconditioned cows, and Gail knows everything about this because we did a few podcasts about this. But the overconditioned cows, they appear to have a high inflammatory response. So the inflammation, those group of animals, all the inflammatory markers that we have looked at, aptoglobin, cytokines, they are higher in the overconditioned cows prepartum. So our belief is that this therapy might help to bring that inflammation down. And this inflammation most likely might be associated or related to a higher mobilization of fat tissue, a higher metabolic stress that we know, there's so much research have shown that fat cows, they have a higher chance or higher risk of mobilizing more fat tissue. So most likely those two are linked. But what we have found when we look at inflammation is that prepartum, those overconditioned cows are already higher. So by this alternative, these therapies, we might modulate in the low enough to prevent the metritis later on, right? Or the higher risk for metritis. Great question.
Thank you.
Chad asked us, what are some of the major nutritional imbalances or nutrient deficiencies that you might look at to be contributing to high metritis incidences?
Yeah, that's a great question. That's a great question. And disclosure there, I'm not a nutritionist, so this is not my main area, but basically it's any nutritional deficiency that will affect the immune system, right? So vitamin E, selenium, low energy diets. So anything that will have negative effect, low calcium, right, on the immune system is gonna increase the chances of developing metritis. When we think about metritis, such a simple disease, is either impaired immune system or pathogen exposure, right? So we have to be clean in the postpartum, prepartum, maternity, and postpartum. We have to be clean, and then we have to keep the immune system robust and strong. And if we do that, we're gonna prevent metritis, right? But yeah, sorry, I cannot answer that more broadly, but that would be my main comment on that area.
Chris is asking, what type of antibiotics are the best to use when treating mastitis? And he indicates two that they use. He came on maybe a little late. Can you give him some answers there?
Yeah,
And the question does say metritis, not mastitis.
Oh, I'm sorry. Yes.
I assume that, Fred, so
Yep.
don't worry. The question, the short answer is talk to your vet, right? But if you're the vet, the studies haven't shown difference between the main antibiotics labeled for. So Ceftiofur, penicillin, so those they have similar effectiveness against metritis, and those is a fairly easy disease to treat. Systemic antibiotic usually it does the job well. And the most of the studies that I'm aware of, there are a few that actually compare different antibiotics. They didn't find difference. They're both effective, or most of the antibiotics utilized for and labeled and allowed, let me put all those words back there, are effective at curing metritis.
Very good. One of the things you talked about was the study where we saw that inflammation before the cows calved. How long before the cows calving does that actually start?
Yeah, that's a good question. I mean, in the Hasse et al. Study, it was around calving. Before calving, they didn't find anything. I mean, in our studies, we haven't looked at that back, but we have found that it really varies between cows. When we look at those heifers that will become first lactation cows, there's like no inflammation at all until calving. It's like flat. There's nothing there. But when we look at the older cows, second lactation or greater, those cows actually, they had different patterns before calving, right? I think that we don't have enough data yet on that. And the data that is out there suggest that it's start at calving, and at calving is when they start branching out based on inflammatory. And one of the really hot concepts out there about inflammation, and Dr. LeBlanc has a review published this year, I think, is like when it comes to inflammation and reproductive tract disease or reproductive performance, we don't have a cutoff yet. We don't know how much is too much inflammation. We don't know how much is too low, right? So it's like at this point, and I had this question a couple of weeks ago in another webinar, and I said at this point, it's like, we're just looking for difference between the groups. And these groups are higher, these groups are lower, and this group actually have altered performance. Those, that is the range that we're looking, but we don't have a cutoff, to be honest, as of today, right?
In one of the slides, you had demonstrated where the cow was experiencing pain. She was hunched up. Should we be treating for pain to those cows that have metritis?
Yeah,
I didn't want to make the mistake a second
time. Short answer, yes. And especially after that study that showed from Dr. LeBlanc that he's treating cows with ketoprofen, which is an anti-inflammatory medication, anti-inflammatory, which means that also it's going to take some pain away as well, right? So pain and inflammation are related. And they're having similar effects when it comes to the cure rate of those animals. So the short answer would be yes. Now, what to use, especially in the States, is a different question that I don't have the answer for that these days. But I mean, that is something that we need to do more research on, managing inflammation and pain, and we might end up with a whole deal when only by managing inflammation and pain, we actually also are curing these animals. We don't even need antibiotics. That would be the ideal scenario.
Okay, Chad asked us, is aspirin FDA approved for dairy cattle? If not, is it expected to be, and what are the barriers for approval? Boy, that's a loaded question, ain't it?
That's a good question, Chad. And if well, Fred, you mentioned you guys have a webinar coming up soon, December 19th. So Chad, look for that. But it's not. That's the short answer. It's not approved. It never has been approved. It cannot be used even in extra label manner. The only form of aspirin that can be used is in an extra label manner is a human form, which is called basolorate. And each pill is about this big, so you need about a couple hundred pills to treat a cow. But it's expected to be approved. When I started doing research with aspirin about 12 years ago, I thought so, but that was 12 years ago, and we are in the same scenario. We were thinking that with all these trials that we're doing and all this data and sort of all these promising results, we're finding that somebody will come up and move forward with the whole approval process. But I don't know. I think that maybe now with the new regulation that they're being more strict about the use, maybe that will be beneficial for an actual approval. But the short answer is I don't know, Chad.
Okay. I'm not seeing another question come through in the chat box. If somebody wants to unmute and ask a question, we'll give a couple of seconds for that. Otherwise, I've got a closing question. Gail knows that I'm kind of a numbers person. So when we're talking about the benefits of aspirin and meloxicam was milk production. But did you study the economics? Is there enough increase in production to actually make it economical?
Yeah, that's a good question, Fred. And I mean, the meloxicam study was pre-Parton, because when it comes to that economics, so the short answer is we did not do a formal economic assessment, right? But perhaps a comment on that is when we think about the cost of this is going to be the treatment cost and the milk waste cost, right? For the waiting for the medication to be withdrawn from the system. But since these are pre-partnering strategies, it's basically the cost of the medication. When it comes to meloxicam, the animals that we treated, those heifers that we treated that become first lactation, they have about 11 pounds increase in milk for the first 150 days in milk. So I didn't do the economics, but I think that definitely this economical benefit there on primiparous cows treated with meloxicam only. Okay. Now I'm really driving away from sort of those blanket treatment approaches that we used to do 10 years ago. So I don't want to go on and recommend everybody, hey, maybe you can treat all your heifers with meloxicam, because I don't want that to be the message here. We are looking at what heifers might need to be treated, right? And even the effect on milk might be even bigger on those animals, right? Because what we're seeing now, overall, we're seeing an increase, but that increase is being leveraged by certain group of animals. I don't believe that all the heifers need that. There might be a specific group of heifers, such as overconditioned heifers or heifers with other features that might be increasing that inflammation. But yeah, the short answer to the question, Fred, is that yeah, it might be economic benefit from those strategies.
Well, thank you very much. We appreciate the information. As you mentioned before, if folks have additional questions, they can email you. And we thank everybody for attending. We'll look forward to having a good discussion on the 19th when we talk about aspirin in our bovine industry. Again, thank you, Dr. Barragan. We appreciate your program.
Thanks again for the invitation, Fred and Gil. Take care.